just a little discussion. I have just been feeling so good. As an example, yesterday I felt like I can remember a time when I was 18 years old that I felt like this, that I was full of energy and optimism, and you know, the world was at my fingertips, and I felt like that yesterday, and I never thought it could happen again, and so.
All this time I was praying that God would direct my path because I was scared. I was scared. I just didn't know what else to do. So got here November 4th, started treatments. PET scan was what, the 16th or the 14th? And it's amazing. This tumor that was just out of control one's gone completely. There's nothing in my lymph glands. And the other tumor is, what, almost 2 centimeters, where it was 4. So, hallelujah.
Yes, it is important to research things, to look into it, to look for alternative treatments. There isn't just one way to treat cancer, and I have been getting very good results. I believe these treatments have kept the cancer from spreading. It is not metastasized, and my cancer antigens keep going down, and my cancer has been becoming less active, and it is just very important to look into it.
I've had no side effects like you have with chemotherapy or radiation. I didn't lose any hair, I didn't get sick, I didn't throw up, nothing. I felt normal. And so to me, there's just no comparison.
Up until almost 2 days ago or a week ago, since I started this treatment, I came in here, I couldn't even walk. And now I'm walking, getting stronger, and like you said, the tumors are all gone. The one on my lung hasn't grown any at all. This guy just should be going in the medical books.
Well, thank you so much, Mr. We're glad to provide you service. We are honored and pleased to have you here. And we continue taking good care of you, and we hope that this information could bring more attention to this field of integrative and natural medicine.
And I'm honored to be here, to have you as my doctor.
Thank you very much for sharing the information with us.
You're more than welcome, Doc.
Well, good afternoon, everybody. As Frank mentioned, I have extensive training in conventional medicine. So I would say that some of the speakers come here and they attack conventional doctors. I would disagree with them. I think that conventional, even oncologists, they have contributed to the health of some cancer patients. Being said that, I also have major concerns about chemotherapy and conventional treatments if they are given blindly. So what I think is that if we combine the both methodologies, both natural and conventional medicine, we can get the best results.
Dr. Nezami.
Thank you, thank you, thank you. Good to be here. Thank you. So the higher the ferritin, the lower the prognosis, the worse the cancer. Coming to the market, they shorten the telomeres, because the same thing happens in cancer cells, right? You shorten the telomeres in cancer cells so they cannot survive. They die faster. But the same thing happens in the immune system. Of the immune system, white cells, white blood cells, they have telomeres. It indicates what's the age and lifespan of a white cell. Isn't that important that in order to boost the immune system, you have to have a prolonged life of white blood cells, right? So they can stay in the system and fight with cancer. Now, most of the cancer therapies that are newly advanced case, 48-year-old referred to me by another integrative cancer physician. I'm sure you are familiar with Dr. Whitaker in Newport Beach. He has been doing this medicine for the last 30 years. His clinic called me for a case. They knew that I like difficult cases, and of course she was local too. So they referred this patient to me. She had stage 4 breast cancer with metastasis to the lymph nodes as well as liver. The liver was so bad that when I looked at the PET scan, I was horrified. The liver was just replaced by cancer. There was nothing left in the liver tissue. The liver enzymes were sky high in hundreds and some of them in thousands. And she had a severe ascites. And so I started to treat her, and I used my own protocols that are kind of different. And she responded. In a few weeks, her liver enzymes normalized. The ascites is completely gone.
Dr. Nezami, thank you very much.
You're very welcome.
Thank you.
Thank you.